Hi, I'm Pam Taub. I'm a cardiologist and professor of medicine at UC San Diego, and I am at the annual CMHC meeting in Boston. And I have two of the future leaders in cardiometabolic health with me, and they are part of our first scholarship program that we have developed. And as part of the program, they've been able to attend two of our meetings and have also had some great networking opportunities at these conferences. So I would love for them to introduce themselves.
Hello, everyone. My name is Courtney Bess. I'm a third-year cardiology fellow at UT Southwestern Medical Center.
Hi, everyone. I'm Aarthi Thakkar. I am a first-year cardiology fellow at Duke University.
Well, congratulations on being selected. One of the questions that I had for you guys is, what are the gaps currently in fellowship training in terms of cardiometabolic health? What are areas that you feel like you don't have enough exposure to?
Yeah, so, just starting out cardiology fellowship, it is a little bit limited what I've been exposed to, but I can already tell you when we're thinking about our boot camp and our introductory lectures into cardiology, a lot of it ends up being focused on procedures and CCU and really the end stage care. There's started to be a greater influence, I think, on prevention and what we can do to help with prevention, but it ends up almost being an afterthought.
I would also like to echo Aarthi as well. Primarily, a lot of training is based off of dealing with patients who are will need actually a high level of care. And I think prevention is sometimes more so built in at the end of your training. So it's currently right now I'm in outpatient clinics and learning how to aggressively treat from a primary and secondary preventive standpoint. It would have been awesome to receive a lot of that training in the beginning or actually throughout my training. So I'll be more prepared as a clinician, being a faculty member at particular facilities.
Great. So it sounds like there's a lot of great pearls you've learned from some of the lectures that you have had the opportunity to attend here at the conference. What are some things from the meeting that you have actually applied to your clinical practice?
Yeah, so we were lucky to be able to attend the women's master class in August of this year. And after that, it seemed like takeaways were just immediately applicable. I remember having a patient in the VA who came with his 5 daughters who asked what should they do about their care, even though they weren't necessarily my patient. I then was able to launch into a excellent little soapbox about why women are so undertreated in cardiovascular disease, and they all walked away making appointments with their cardiologists. And then I was on my vascular prevention rotation, and it was incredible to be able to say, all right, I have actually seen these labs, and I understand now we should actually be treating you as secondary prevention, whereas we might have treated someone originally as primary prevention or not treated them at all. And a lot of that came directly from the lectures that we were seeing in the Women's Masterclass, and again here at the Cardiometabolic Congress, and from conversations that came. I'll say one of the biggest and most wonderful things about this program is the connections I've made with the other leaders. When we're talking about, okay, what do you do at your program, and how does that change, and it being able to apply that directly.
I've also received a tremendous amount of information from both the Women's Masterclass as well as the current conference that I'm at right now. Specifically, obtaining lipoprotein A in all my patients. That's currently involved in the ESC guidelines, but I think it's more so going to be very important as hopefully it'll be assimilated into the guidelines for ACC and AHA. And just more so identifying patients who potentially could be at higher risk for ASCVD in the future, and more so aggressively treating or placing them on particular therapies that will more so address their other cardiometabolic disease processes, such as diabetes, hyperlipidemia, more so the LDL, and their weight. The other things that I've been interested in or obtain more information about is colchicine, the particular information I received this morning about the synergistic properties and management with hyperlipidemia, as well as the inhibition of inflammatory processes, is going to be very important coming up in the future we may be treating patients with, liver-lowering therapies as well as with colchicine. That's very promising and very important. I think it's very exciting. I'm also very grateful to have been involved in this program where we've had a lot of mentorship, and we've been able to integrate ourselves with a lot of leaders in the field. And I think that the mentorship will be very applicable in the future, as well as very advantageous in the future as well, in terms of like getting involved with particular projects or collaborating in community efforts.
Well, I know that you are finishing your cardiology fellowship. You already have a position. You're going to be starting your clinical practice very shortly. So it's really exciting that you've had a lot of great clinical pearls that you're going to apply, that you're already applying as a third-year cardiology fellow. So very exciting. And you still have 2 more years of cardiology fellowship to really apply. And I'm so excited to see all the things that both of you will accomplish as our future leaders in cardiometabolic health.